this week's Cardiology Countdown, we start with an interesting study in atrial fibrillation ablation that used an intracardiac monitor to look for early recurrences to try and direct early re-ablation if needed. So a study of a little over 200 patients looked for early recurrences. If there were none, then patients were followed and did very well. But if there were early recurrences, they were randomized to receiving either medical antiarrhythmic therapy or an early re-ablation, and then followed subsequently, and ablation done after the follow-up period if needed. What was seen was with the early monitoring, if there were triggered events with early APBs or Afib that recurred, early ablation was able to permanently lead to a cure in about 80% of patients versus the drug therapy in that setting, only about 30% of patients were prevented from recurrence. And so a way to utilize the intracardiac monitoring device to direct early management. The number 2 spot this week is a study of CABG that looked at use of the right internal mammary artery in addition to the left as compared with the radial artery. Now this was a series of 1,000 patients followed for about 4 years on average where they did a propensity matching, so not a randomized study, where they found better outcomes in patients who received the bilateral internal mammary artery grafting as opposed to lima and radial artery. This is an important series and refocuses attention on which may be the best approach. There are obviously anatomic reasons for consideration, but boosts up the notion of bilateral internal mammary artery grafting. At the number 1 spot this week is the ARMYDA-6 trial that looked at the optimal loading dose of clopidogrel in primary PCI patients. This was a small study, just 200 patients, but one that looked at various measures of infarct size with enzyme elevation size, as well as ejection fraction and outcomes. And they found better outcomes in those randomized to a 600 milligram loading dose as opposed to 300 milligrams given in the emergency department in patients undergoing primary PCI for a STEMI. This has been incorporated in the guidelines, but a nice randomized trial supporting its use. So with this week's Cardiology Countdown, I'm Chris Cannon.